When it comes to mental health content on YouTube, especially content about complex conditions like dissociative identity disorder, there's been a growing conversation about who should be sharing information, how it's presented, and where the line is between personal experience and advice. One of the most well known creators in this space is Dissociated. They've played a major role in raising awareness about DID for a wide audience. But alongside that visibility, there has also been ongoing debate and criticism about whether this type of content should be seen as educational guidance. So, in this video, we're going to break down why some viewers, clinicians, and even community members feel that dissociated and similar creators should not be giving advice and instead should be treated strictly as personal experience sharing, you know. This is not about attacking anyone. It's about understanding the responsibility that comes with talking about complex psychiatric conditions in a public space. However, it is important to acknowledge that many supporters argue that these creators fill a major gap in mental health education, especially for conditions that are often misunderstood or misrepresented in mainstream psychiatry and media. One of the core issues in this discussion is the difference between lived experience and clinical education. So, Dissociated presents content that includes explanations of DID, system communication, trauma responses, and even internal experiences. For some viewers, especially those newly exploring DID, can feel educational. But critics argue that there's a blurred line between this is what I experience and this is how DID works. That concern is that DID is a highly complex trauma related dissociative disorder that varies significantly between individuals. And yeah, like even trained clinicians often disagree on presentation, diagnosis, and treatment approaches. So, when personal experiences are presented in an explanatory or instructional format, viewers may unintentionally treat it as generalizable or clinically accurate information. On the other hand, supporters argue that lived experience is itself a form of valid knowledge, especially in fields like trauma and dissociation, where subjective experience is central and often underrepresented in clinical literature. They also argue that creators often do explicitly frame their content as personal rather than universal. Another concern raised is the potential for misinformation, not necessarily intentionally, but structurally. Mental health conditions shown on social media often get simplified because of the format. Short videos, storytelling, and relatable content can make experiences feel universal even when they aren't. Critics argue that DID content specifically can lead to oversimplified explanations of switching or identity states, misunderstandings about diagnostic criteria, confusion between DID and other dissociative or trauma related conditions, as well as just romanticized or dramatized portrayals of internal experiences. The issue here isn't that creators are lying, but that social media rewards clarity, narrative, and engagement, sometimes at the expense of clinical nuance. When audiences rely heavily on creators for understanding, there's a risk that incomplete or subjective interpretations become accepted as fact. However, supporters counter that this risk exists in almost all mental health content online, including content from influencers, educators, and even some professionals. They aren't that they argue that the situation, or the solution I should say, isn't discouraging lived experience content, but improving media literacy and encouraging viewers to consult multiple sources rather than relying on a single creator. A particularly important concern is the audience itself. So, like, a large portion of viewers engaging with DID content are teenagers or young adults, people seeking explanations for distressing experiences, and individuals exploring possible trauma or dissociation symptoms. In these situations, parasocial trust can develop. Viewers may begin to see creators as authority figures, even when the creator is explicitly sharing personal experience. Critics argue that this can lead to self diagnosis without clinical evaluation. It can promote misinterpretation of normal psychological experiences as pathology. There's delayed professional treatment and even reinforcement of identity frameworks that may not reflect clinical reality. This is where the question of advice becomes particularly sensitive. Even well intentioned suggestions can about coping strategies or system communication can be interpreted as broadly acceptable treatment guidance. Supporters of creators like Dissociated argue, however, that their content often encourages self reflection rather than self diagnosis, and that many viewers actually report being motivated to seek professional help after learning more. They also argue that without online creators, many people would have no access at all to relatable information about dissociation, because it's a spectrum, really. On platforms like YouTube, visibility often equals credibility, and creators with large audiences can unintentionally gain authority simply because they were watched widely. So, this creates a dynamic where engagement replaces expertise. Relatability, replaces clinical validation. And personal narrative becomes perceived as educational truth. Critics of Dissociated and similar creators argue that, regardless of intent, large scale DID content creators occupy a space that resembles mental health education without the safeguards of formal training, peer review, or even clinical oversight. This is especially important because DID is still debated and heavily researched within psychiatry. Even among professionals, there is ongoing discussion about diagnostic frameworks and best practices. On the other hand, supporters argue that clinical spaces themselves are not always accessible, validating, or trauma informed, and that online communities have been an essential supplement, not a replacement, for mental health understanding. They also note that no algorithm is designed to prioritize licensed accuracy and only engagement, basically. So it's important to be clear, This critique is not an argument against sharing lived experiences. Personal storytelling can be incredibly valuable. It can reduce stigma, help people feel less alone, and encourage individuals to seek support. The concern is specifically about framing. Many critics suggest that the healthiest approach would be to clearly separate lived experiences from general claims. Avoid instructional or advisory language about treatment or system structure. Encourage viewers to seek professional evaluation for diagnosis and care, as well as emphasize variability in how DID can present. This allows creators to continue sharing their experiences without unintentionally positioning themselves as authorities on clinical mental health education. Supporters agree with parts of this, but also argue that overly strict boundaries can silence important voices and reinforce stigma. They point out that historically, many marginalized health narratives only gained visibility, please speak, thank you, only gained visibility through patient-led storytelling, not clinical gatekeeping. So why do some people feel dissociated shouldn't be giving advice? It it comes down to a few key concerns. So, one, the complexity and variability of DID as a diagnosis, the risk of personal experience being interpreted as universal fact, the vulnerability of audiences seeking answers, and the influence that large platforms give individual creators. Ultimately, this conversation isn't just about one creator. It's about how mental health is discussed online and how easily the line between education and storytelling can blur. The most reasonable approach, according to many critics, is not to silence these voices, but to clearly define their limits. Because when it comes to mental health, especially something as complex as dissociation and trauma, clarity about what we know and what we personally experience matters more than ever. At the same time, supporters argue that lived experience content remains one of the most accessible and emotionally impactful forms of mental health communication available online, and that dismissing it entirely risks erasing important perspectives from people who have historically been unheard. But at the end of the day, this isn't a simple black and white issue. Conversations like this can get heated, especially when they involve real people, real trauma, and real audiences trying to make sense of their own experiences. But that's exactly why it matters to approach it with nuance. You can acknowledge the impact someone has had in raising awareness and still question how that information is being presented. You can value lived experience and still recognize the importance of professional guidance. And you can critique content without dehumanizing the person behind it. If there's one takeaway from all of this, it's this: be mindful of where your information comes from. Question what you're told, even by people you trust, and don't replace professional help with online content, no matter how relatable it feels. At the same time, don't dismiss the power of shared experience either. For a lot of people, that's the first step towards understanding themselves at all. So the goal isn't to pick a side, it's to stay informed, stay critical, and most importantly, stay grounded in reality. If you found this video helpful or thought provoking, Let me know your thoughts in the comments, but keep it respectful, please. These conversations only matter if we can have them responsibly. And, yep, with that, thanks for watching.